and continue from where my doctor stopped, and let's see how we can put some icing on the cake, okay? So I'll be sharing my screen with you guys, and so we can just move on. So if you can see my screen, you let me know, okay? Okay, let's go. So if you can see my screen, let me know.
Yeah, we can see.
Oh, perfect, perfect. So now my partner talked about breast cancer, prostate cancer, causes, symptoms. So I'm going to be talking about prevention, lifestyle, and diet, because these are the little things that really affect us that we don't even know, because we don't feel that they are normal, but they play more role in us having this cancer and normal things that we don't know. So let's get started, and let's get started with breast cancer first, okay? So now for breast cancer, there's some things that we shouldn't do. I'll say we should do. Now, we should stay away from what? Radiation. As my partner said earlier on, that radiation, either from sun rays or from radiography or anything, but we don't have contact with X-ray frequently, because we only have it once in a while. But it's the sun, it's almost every day because you're exposed to sunlight. Now, what you should use now, there's some women that use this kind of bra that is called the push-up bra. Now, this push-up bra is totally fashion, so the breast can actually pop up and make them look pretty, I guess so. And there's some cloth that they use that is, they call it the open or outer neck or open neck. I don't know what it's being called. So the chest region can be seen and their breast can pop up for fashion. It's very good, it's beautiful, but this sun is having direct contact with your chest region and your breast. And this can also trigger cell degradation and death. And because, as my partner said earlier on, that cancer simply means that when cells start behaving abnormal, and this radiation can actually start making the cells in the breast behave abnormal, okay? Then breastfeeding. Breastfeeding is important, as in fact, this breastfeeding is a topic that can take like the whole day talk about breastfeeding, because some women have this mentality that once I breastfeed, then my breast is going to fall. I'm going to have a saggy breast and stuff like that. The answer is actually no. Even if you breastfeed for 2 years, you're not going to have a saggy breast. The way you breastfeed determines how your breast will be. For example, if you are breastfeeding and the head of the child is very far from the breast and the child is dragging the breast, that will lead to a saggy breast. But you put the child's head very close to the breast and the child sucks the breast, it will not make you have a saggy breast. Now, talking about breastfeeding. If you're breastfeeding your child, this also prevents woman having breast cancer. There's some ladies that are not married, do some issues, but they are in relationship. Now, talk to your partner. Your partner should actually help you suck your breast. It's not some sort of fun or joke. It is real. Now, when you're sucking the breast, you don't just suck the breast as if they're sucking an orange. No, you suck and caress it gently. That you're helping to massage the breast, and any lump or anything can be broken down. So as my partner said earlier, as my doctor said earlier, not all lumps in the breast are cancerous. No, there's some ladies that have normal lumps that are not cancerous, but with breastfeeding and massaging, you can actually break this lump. You understand? So breastfeeding is important for ladies to prevent breast cancer. They should quit smoking and alcohol. Now, you say, what does smoking has to do with breast cancer after the smoking affects just the lungs and not the breast? Now, what they call free radicals. Now, free radicals are cancer-causing agents. And if radicals are present in your smoke, your dust, and your particles that you cannot see, so when you inhale them, they come to your system and they start playing with your cells, and your cells start behaving abnormally, then it can lead to cancer. Now, since we are talking about just only cancer of the breast, so they will just go to just only the breast alone. So this radical can actually cause cancer to the breast alone. So please try to quit smoking or stay away from secondhand smokers, because secondhand smoke, because you believe, okay, I don't smoke, but you're always sitting around people that are smoking, can also affect you, because if you're not smoking, but you're a secondhand smoker, that means the smoke is getting to you, can also affect you negatively. Now, sleep, you have to sleep well. You need a lot of rest. At least in a day, you need at least 7 to 9 hours in a day. So what we recommend is this: you sleep for 9 hours in a day. Now you sleep for at night, sleep for just 8 hours. Then in the day, try to take a nap for 1 hour. If you try this for a month, you see that your health will change for the better. Try to take a nap, your normal 8 hours at night, then 1 hour at daytime to actually help your health. Then also regular exercise and weight management. You have to exercise yourself, because once you exercise yourself, your body is moving, your cells try to fight off the other bad cells, because of what you are moving. If you're not doing anything anytime, you're actually gaining more weight. This can also is what contributing factor to cancer. So because of time, let's move to the next slide, which is actually the food pyramid. Now, the food pyramid, I'm not going to talk about the fruits and vegetables, because the carbohydrate, protein, and everything, you need to eat them. Carbohydrate 5%, protein 15%. Fruits and vegetables are important. Why? Because they contain vitamin E. Now, what is the function of vitamin E? Vitamin E, the major function is what? Mopping out of excess free radicals. Now, the vitamin E go to your system, and when you have free radicals, they try to mop them out and clean them. That will also clean your system from having these free radicals roaming in your system. There are also whole grains. Also, eat more whole grains. It's important for your health. Now, I think we are running out of time, so I don't go to glance. Just send me your questions if you have questions. Okay. So now let's go to prostate cancer. Now, as my doctor said earlier about prostate cancer, where it's located and everything, I hope you've heard about prostate cancer. So I would shed some light on it, okay? Now, as a man, you're not supposed to sit down in a position for more than 2 hours. No, because if you are sitting there, you actually sitting directly on your prostate. So once you have sat up for like an hour, 30 minutes, what do? You start to stand up, walk around, then you come back to sit down, because you are seeing directly your prostate actually need rest. Then then your phones in your pocket. Now you understand, if you put your phones in your pocket and someone actually calls you and the phone start vibrating, they're rays, and they have been emitted from the phone. And these rays can actually affect your prostate, because it's directly very close to your prostate. There's your legs or your lap. So it can actually affect your prostate. Then also during withdrawal method, as my partner said earlier, that the prostate actually release your fluids, you understand? Now, once you are having sexual intercourse and there is a withdrawal method, and you don't want to actually release in her to prevent pregnancy, or release in your wife to be pregnant, what do? You try to release. And once you try to release, some sperm comes out, but not all of them come out. You notice that like after sexual intercourse, after like an hour, you see like some drop of sperm after intercourse. Those are the sperm that are also in you. And most time these sperm don't die. Sperms are their cells. And once they don't come out, they are inside, and they cannot actually go back to where they are. So once they are out, they can't go back in. So what happens? They are there, and it can actually affect your prostate, leads to prostate cancer. Okay, so then let's go to your watch actually put on. You put on your when you are wearing clothes that are actually your boxers, your underwear that are actually dark and thick. You should know that dark color attracts heat. It's just like you're putting your testicles, everything under the heat. Now what happens is like that's what boil it, and that can actually affect your prostate. So if you want to put on anything dark, make sure you're putting on a clothes that is light, now not something that making you sweat or making you sweaty. So, and also I recommend you putting on a light colored cloth and not dark color underwear. That can help you. Okay, then that's engage in regular exercise. Now, exercise is actually important, and get tested. You should always get tested. Now, back to that is all on my prostate cancer. Then back to my breast cancer. Now, what they call breast self-examination. How do you do this? As a lady, in the morning, look at the mirror, put off your clothes, raise one of your hand up. They try to feel your breast, put your hand around your breast and try to massage to feel any lump. Now, if you are feeling any lump, try to touch it and see if you're having just 1 or 2 lumps. If you're having like lumps in your breast, what do? You go to the hospital to seek attention of the doctor to get yourself tested. So I want to say very thank you for your time. Thank you for joining us. If you have a question, you can actually send your question the group, to the chat, and we can answer your question. Thank you very much. We'll appreciate you. So I think we are far behind in terms of time, but I will just check if there are any questions to be answered. Okay. Okay, I think we have a question here. Okay, for now there are no questions, and I think we are actually almost behind.
We are almost.
Yes. So, Dr. Momore, any closing notes, because we are behind?
Okay. Closing notes is that prevention, like I said before, is not only better but cheaper than cure.